Hello, my name is Gabriel Soriano. My teacher is John Moscoso. My topic is vitamin D supplementation during pregnancy and the prevention of childhood asthma. Definition: in childhood asthma, the lungs and airways become easily inflamed when exposed to certain triggers such as inhaling pollen or catching a cold or the respiratory infection. Childhood asthma can cause bothersome daily symptoms that interfere with play, sport, school, and sleep.
Asthma is a chronic disease of the lungs, and it can occur as early as 6 months. It can occur later in life as well.
Normally, the way your lung functions is that you have airways that go from your mouth into your lungs, and they end up in little air sacs. In the normal lung, those tubes are wide open. It makes it very easy for air to flow in and out. In somebody with asthma, those tubes or airways are narrow because the wall of the tube is inflamed, so that makes it more difficult to breathe in someone with asthma. It's like breathing through a straw.
Children with asthma can have different signs, also known as symptoms, that show their asthma is not well controlled. Common symptoms of asthma are wheeze, a whistling noise in the chest, cough, especially late at night, shortness of breath, and chest tightness.
Asthma can look many different ways. Some children may cough with their asthma, some children wheeze, some children work really hard to breathe using their chest muscles and their stomach muscles.
They may cough when they exercise. They may cough when they go out in the cold air.
You step outside, you run across the yard one time, he's coughing. We got to pick him up, bring him in the house.
When they get a cold, the cold may just not seem to go away.
Coughing or awaking after midnight in the middle of the night, that's the most severe symptom.
When you have a child who is waking up at night with a cough, then they're experiencing the beginning of a flare.
Most people associate asthma with asthma attacks.
During an asthma attack, the inflammation process kicks in the lungs. The muscles tighten around the airways, extra mucus is produced, and there's swelling in the airways. The patient can feel pain or shortness of breath.
I have an attack. It's not a good thing. My chest hurts. I cough a lot. Like every time I breathe, it just didn't feel right. It hurted.
Me and her father had to rush her to the hospital.
Asthma flares, also known as attacks, occur when swelling in the airways worsens. This can happen due to a cold virus or a trigger in the child's environment. If a child's asthma is not well controlled before the flare, symptoms can be more severe. Symptoms of asthma such as wheeze, cough, or shortness of breath are early warning signs that a flare may be beginning. The key to preventing asthma flares is to control daily symptoms of asthma and recognize early warning signs when symptoms are worsening.
Many children think that early warning signs are a normal part of life because they are used to those symptoms and they're not used to their asthma being in control. So it's very important for parents to understand and to stay clued in as to what their early warning signs are, and in fact inform any of the children's caretakers about their early warning signs.
He's silent. He just sits there and days off. And then I just started looking at him, and then I see him breathing, like trying to get some air, go like this. And then I look at his throat, and I see that this part right here starts sucking in. Then I know he is in distress.
Application in medicine. The vitamin D intentional asthma reduction trial is a randomized, double-blind, placebo-controlled trial of pregnant women at risk of having children with asthma randomized to a total daily dose of 400 AU or a total daily dose of 400 AU.
Diagnosing asthma: mild, moderate, and severe. To learn if you have asthma, see a doctor to be diagnosed. The doctor will ask you a few questions, examine you, and do lung tests and other tests. You might need some of these tests on a different day or after taking certain medicines. asthma can run in families, so your doctor will probably ask if anyone else in your family has asthma, allergies, or even colds that last a long time. Your environment, meaning your home, outside your home, your place of work, or other places you spend time, can cause asthma or make it worse. Your doctor will ask you about your environment. This includes if you have pets, live in an area with a lot of grass, mold, or traffic, and spend time around people who smoke. An important asthma test called spirometry checks how well your lungs are working. You'll be asked to blow into a machine as hard, fast, and long as you can. If you don't blow air as much or as fast as healthy people, you could have asthma. You might take the test again after using a medicine that opens up the airways in your lungs. If your results improve, this is another sign of asthma. You might also have breathing tests after using a medicine that makes people with asthma do worse after taking it. Or you might have a test that measures a certain gas called nitric oxide in your breath. People with some types of asthma breathe out more of it than other people do. Your doctor might order an X-ray and other scans to look at your lungs. You might also have blood tests. One blood test checks the number of white cells called eosinophils in your blood. Some people with asthma have high levels of eosinophils. Another blood test checks the level of an antibody called IgE. Elevated IgE levels can be a sign of allergies. Skin tests may also be used to check for elevated IgE. A test called a bronchoscopy uses a tiny tube that goes inside your lungs. Through the tube, your doctor can take samples of mucus or fluid. The samples tell your doctor even more about your condition. Your doctor also should assess the severity of your asthma. There are 4 main levels or grades of asthma: intermittent, mild, moderate, and severe. Intermittent asthma causes symptoms occasionally. For example, you probably have a cough 2 days a week or less. Your asthma does not affect daily activities, and your spirometry results are normal or almost normal. If you have mild asthma, you have symptoms more than twice a week, but not every day. Your daily activities are slightly affected. You probably use a quick relief medicine, such as an inhaler, more than twice a week, and take a daily asthma controller medicine. If you have moderate asthma, your symptoms wake you up often. You use your quick relief inhaler every day, and having asthma impacts your daily activities. You take 1 or 2 daily controller medicines besides your quick relief medicine. If you have severe asthma, your symptoms bother you each day and wake you up on many nights. You use your quick relief inhaler several times a day. You probably take more than 2 asthma controller medicines, but still have symptoms. You might feel like asthma controls your life. Knowing the cause of severe asthma can be helpful in controlling it. Severe asthma can be related to allergies, your body producing too many of certain types of white blood cell called eosinophils or neutrophils, or overdeveloped airway muscles. An asthma specialist can prescribe specific treatment that can help. Many people with asthma have other health conditions. Some do not affect your asthma very much, and some do, such as allergies, sinus problems, and heartburn. Treating these health conditions can be important to help control asthma. Triggers is the term for things that make your asthma worse. It's important to learn about your asthma triggers and avoid them. Common triggers are cigarette smoke, dust, mold, grass or tree pollen, and pet or cockroach dander. Talk with your doctor or nurse about keeping your home clean and free of asthma triggers. For example, you can learn to avoid pollen and wash bedding to get rid of dust mites. If your home has mold or cockroaches, you or your landlord can fix the cause. If you have intermittent or mild asthma, you need to see a doctor regularly. If your asthma is moderate or severe, seeing an asthma specialist routinely is important. Everyone with asthma needs spirometry testing to check how their lungs are working. You might also need other tests to check your asthma. With regular care, you can keep asthma under control as much as possible.
There is speculation that vitamin D may play a role in the development of asthma and other allergies. Cons: high-dose vitamin D supplementation during pregnancy did not reduce asthma or recurrent wheezing in children at 6 years of age.
Pollen, mold, even humidity can send asthma sufferers into a severe meltdown. But a relatively new outpatient procedure is offering hope for adults with extreme cases.
There's a new technology in the treatment of asthma that's called bronchial thermoplasty. We use this technology in folks who have severe asthma and whose symptoms have not been controlled with usual medical therapy.
Adults with uncontrolled asthma often make repeat trips to the hospital, and over time, the chronic condition becomes permanent and damaging.
The tubes that take air into their lungs are inflamed with years and years of inflammation. That tube gets scarred.
The first non-drug therapy FDA approved to treat severe chronic asthma, bronchial thermoplasty directly targets the inflamed airways, and by applying heat gets them to open up.
What we do in bronchial thermoplasty is we take a thin, flexible fiber optic tube with a camera at its tip from the nose down into the lungs. We take it to each individual breathing tube, and at a very, very low frequency, we emit heat energy that allows that muscle around the breathing tubes to shrink.
This technology is available through Lee Memorial Health System. Nationally, data shows the effects have staying power, that 5 years post-procedure, there was a 78% reduction of asthma-related ER visits.
Being well controlled is a huge improvement,
making this hot treatment a life-changing procedure for people struggling to breathe. For Lee Memorial Health System, I'm Amy Osher.
That vitamin D supplementation does not prevent asthma in school-age children. The peer finding of the BDART study suggests that prenatal vitamin D supplementation reduces transient wheezing, although not allergy-related asthma at age 3.
So we're interested in looking at vitamin D levels in kids with asthma and allergies, as well as potentially looking at mechanisms for vitamin D's effects on the immune system. The clinical data that we obtained showed a couple different conclusions. One is we saw that low vitamin D levels were very common in kids referred to National Jewish. The second part of our clinical data looked at features of asthma and its relationship to vitamin D. And what we found is kids with lower vitamin D levels tended to have lower levels of lung function, as well as several increased measures of allergy, such as the amount of IgE antibody in their blood and the number of positive skin tests that they had. We also found, in terms of the medications that we were looking at in kids with asthma, that kids who were taking more steroid medicine, either inhaled or via an oral form, had lower vitamin D levels. In the lab, when we took immune cells and bathed them both with steroid medications as well as vitamin D, there was a greater anti-inflammatory effect than when either of those was used alone to suppress immune cells. This data is very exciting because it has a couple potential implications clinically. One is that if vitamin D helps augment steroid medicines, people who have low vitamin D levels, if supplemented, could potentially need less of these medicines. So vitamin D has the potential to have what we call a steroid-sparing effect. Whether it does or not is really unknown at this point. The next step in investigation really needs to see if vitamin D supplementation leads to lower levels of medicine use, better lung function, and better asthma control.